I know you and I both are pretty excited about how we can incorporate immunotherapy into the definitive setting. And so there was some data that has come out not only at ASCO, but in other congresses. And so what do you think about the UPMC data?
Yeah, so as you know, immunotherapy has really been transformative for some of our patients, not only in head and neck cancer, but in a lot of different cancers. And the idea of it's really attractive, turning on the body's immune system to help it fight cancer. It's been in use for years now in the for patients with metastatic head and neck cancer, but we're still struggling to figure out how to bring it to more of our patients, those with locally advanced disease. Results have been a little bit disappointing so far. There's been a couple big high-profile trials with combining immunotherapy at the same time as chemoradiation that have not shown that we improve patients' outcomes. So the Keynote 412 trial, the Javelin trial, both were negative trials that I think really disappointed me and a lot of other people in the field. So one of the questions that came up with that is, are we giving immunotherapy at the right time? Both of those trials gave immunotherapy at the same time as chemotherapy and radiation. And this trial that was reported was out of the University of Pittsburgh Medical Center. And it used two different regimens of immunotherapy in combination with chemoradiation. In one of the arms, they started the immunotherapy at the same time, or actually a little bit before chemoradiation, and then continued it afterwards. In the other arm, people got standard chemoradiation first and then received immunotherapy afterwards. The people in that second group did a little bit better. It was a small trial, tough to really draw definitive conclusions from it, but some interesting data showing that, maybe doing it afterwards might be the best thing. And maybe the reason why these trials have been negative so far is not because immunotherapy is not good, because we're just not giving it at the right time. And I know we've talked about this offline as well, that there's a lot of different opportunities here to study this. What do you think the right time for immunotherapy is?
Yeah, I couldn't agree more that the data so far has been really disappointing and surprising with the Keynote 412 data. And so that it was negative. And I think, and you treat lung cancer patients. And so that certainly is a field where we can take experience from them. And there's been success with immunotherapy after chemoradiation therapy. And there's also some new data that's showing that immunotherapy combined with chemotherapy may be effective and prior to surgery. And so I think those are both potential avenues for evaluating immunotherapy and not doing it concurrently with radiation therapy. And so there are a lot of efforts, including at our center and others, I'm sure at yours too, to answer this question. And there's going to be just a ton of data that comes out. So this is going to, I think there's still a lot of enthusiasm with using immunotherapy in the curative setting.